The broadcast is now starting. All attendees are in listen-only mode.
All right. We have people coming in here. Obviously, we're about 9 minutes away from starting. We're gonna let some more funnel in, and we will start at the top of the hour, and go from there. Today, we're just gonna go over a little bit. It's actually very easy. We're gonna just go over why IAMS. It's gonna be more talking than anything. I don't really have a whole lot to show you, but I will also be going through our website. And our website, um, just to give kind of just so you know where the Medicare page is really and some of the highlights of what we offer. So, like I said, here at the top of the hour, we will start it, but we are definitely starting to funnel in here. All right, we are still funneling in here. uh, we're still funneling in. We will do the webinar. We'll start it here just at the top of the hour. Again, today's going to be very easy, very quick. For the most part, my webinars tend to be an hour. I'm trying to hit half that, if not a little less, actually, today. I know this week's a busy week for everybody, so I do appreciate the ones that are already on. We got a busy week, so with Thanksgiving and everything, and I know AEP's wrapping up, so with limited schedules and so much work to do, I do appreciate everybody that's on here, but we'll go over a little bit about who IAMS is, what we offer, and take it from there. Just going to answer some pre-questions. Yes, we will be doing Q&A again today, so feel free to answer in the question or ask in the questions box, if you will. But yes, we will be doing a Q&A. So as I'm talking, we will ask out loud if you want to go over any scenarios, questions, tools, how they operate, whatever it may be. Give me a heads up. Another thing we're going to touch on today is building an agency. If you want to do that, I've had quite a bit of agents ask me about that, so we will touch on that. Yeah, like I said, here about a minute. We are funneling in here, so I might give it to like 10:01, 10:02, let everybody get settled in. And I know I see some people trying to get their microphones turned on, and then we'll get it going. All right, let's do this. So, again, we are going to be doing live questions. So feel free to use that chat box. I will stop as we go and answer all questions out loud. Today is actually going to be a little bit of a simpler webinar, if you will. It's just more or less we're going to talk about why to bring your business to IAMS. Everybody that knows IAMS knows. Oops, sorry. Uh, there we go. Everybody knows IAMS. For the most part, knows big annuity shop. We do a lot of annuities, wealth management, some life. What are we doing getting into Medicare? And that's going to be one of the biggest things I go over today. Another thing we're going to go over today is I've been having a lot of questions on Medicare Advantage and how the drastic differences between Medicare Advantage and Medicare supplements. I get asked a lot, Alex, which one do you prefer? Well, that's not really a fair that's not really a fair question because they both they do ultimately they're trying to accomplish the same thing, but they have different outlooks, right? So that's gonna be another thing we go over. Incentives, how to utilize incentives, how to utilize what we give you to your fullest advantage, really. And like I said, another thing is ask questions, go through that. I am going to show you our website, new developed senior healthcare page, just so you can take a look at that and always follow exactly what we're doing. We're constantly updating it since I've come on board. We've definitely added some more carriers to our portfolio and some of the things we're doing. where I'm going to explain why some of the carriers are not on there that maybe you're in your area are familiar with. So just things like that. So it looks like I have a couple people pending here. I'm just going to give it a 1 to 2 more minutes, and then we're going to get this started. Start asking questions in the questions box if you'd like. I will start answering those right away, but I don't want to get into the meat of the webinar until I know we have our solid number. We have quite a few people join this today, and I do appreciate everybody taking the time to come on board and hear what we have to say. Okay, let's get this started. So I am going to start here by a lot of agents. They're not so much questioning, but one of the things I get a lot of questions on is why is IAMS in Medicare? What's a heavy annuity shop in life and wealth management shop doing in the Medicare space? Well, what I can explain to you is one of the things that we in the team try to go over is a lot of the agents that I work with, a lot of the agents that we're attracting here, what they're trying to do is they're not trying, but they do claim themselves to be a retirement planner in the retirement business, retirement strategies, retirement advisors, all these different titles that revolve around retirement. What I can tell you is part of someone's retirement is their Medicare. So when you look at it, it's not just tweaking life insurances. It's not just looking at their annuities and helping somebody, not outlive their money and put some, a guaranteed interest rate, whether you're doing fixed or, variable, whatever it may be, annuities, getting into that, the wealth management side, obviously taking care of, that side of the house as well. But another one is their health insurance. And the reason why is because most times when these clients are retiring, they are losing their group health insurance. So if you asked my opinion, your immediate need today is your health insurance, right? You don't want to have a lapse in coverage. You want to make sure, Mrs. Jones, I always use Mrs. Jones as an example on my webinars, right? Mrs. Jones wants to make sure she can still go and see Dr. Phil. I've been seeing Dr. Phil's for the last, you know, 60 years of my life. How do I make sure that I can continue to see him? He has all my records. He knows who I am, how I am. How do I continue to see him? And it's all about getting in the door, not only to take care of their need today, but their later need, which is their money. So a lot of times, and this is going back to my main point, Medicare is a part of someone's retirement. Medicare is a part of somebody's retirement package, if you will, right? I look at it from three aspects: health, life, money, right? And the reason why I say money is it could be annuities, it could be wealth management, it could be whatever that side may be. So that's the reason why IAMS is getting into it. A lot of the people on this webinar today, they are some of our annuity advisors. You know what IAMS is like in the annuity world, right? We do a lot of annuities, work with a lot of advisors, and through a lot of requests over quite some time, from what I understood when I came on board, and we have been seeing it. We are growing very fast on the Medicare side. It's been the need from these advisors. Hey, I want to get involved in the Medicare space. I get a lot of questions about Medicare, and I'm just not versed on it. Can you help me? Because they look at IAMS and say, you guys are in the retirement side, in a sense. Help me. So that's exactly what we're doing. Another thing is I could tell you is Medicare is such an easy product to write. It really is. Um, it's not. It's more black and white than a lot of agents make it out to be. Okay. Now, Medicare is built of it's a lot of small details, is the best way I would put it. Right. But everything for the most part stays the same. A few numbers, a few percentages change here and there. A few rules will change from time to time. But for the most part, a lot of it stays the same. So I'll tell you, Medicare is a very easy plan to write to where I ask agents all the time, do you get into Medicare? No, I wouldn't touch Medicare at all. Well, are you really going to let somebody work with your clients? Are you really going to let somebody else work with your clients over such an easy product? Right? If you can do all these different retirement services, if you could do all these different life insurances, everything like that, why would you not incorporate Medicare? Because in my mind, why let somebody, if you're not going to work the Medicare products, or you're not going to work life insurance, or you're not going to work an annuity, there will be an agent, maybe not all your clients, but there will be an agent that will somehow gain attraction from one of your clients. And don't you want to be able to say, you know what, or I'm sorry, not you necessarily, but your clients, don't you want your clients to say, I'm completely covered? Uh, Mr. Bob, Mrs. Jones, they are health insurance, life insurance. They do everything for me. They take care of all my retirement. Rather than let somebody get in there and potentially gain a traction from your client, and then you potentially lose out on somebody your client's business. See it a lot, actually. See that a lot. A lot of these agents, they use the cross sell. So that's why I would tell you Medicare is definitely a need for you to get involved with when you're talking in the retirement space. Now, another thing about Medicare, okay, is Medicare, and I've said this to a lot of the agents that are on here. Medicare is what I would like to say to be a commodity. And what I mean by that is at some point in time, you are going to have to get on Medicare. You're going to have it. You're going to have to use it, right? So when you look at it from that way, you don't have to have life insurance. You don't have to have an annuity. You don't have to have a wealth advisor. You should, but you don't have to have those things. At some point in time, you are going to have Medicare, whether it's just original Medicare, whether it's a Medicare Advantage plan, whether it's Medicare supplement plan. Some point in time, you're going to have Medicare. So when you look at it from that aspect, and I've gone over with everybody for the most part on here, and if you are new, I do plan on working with you soon, okay? And we'll do a follow up question, everything like that. Um, with Medicare, okay, from a marketing standpoint, so a lot of the agents I work with, what we are doing is we're talking about cents to dollars, right? And what I mean by that is, what are we putting out versus what we're getting in? Medicare, right now we have 4 different lead programs, okay? Well, you have 3. We're working on 1. That'll be our 4th for our 1/1 start date. But I can tell you right now is, well, when you look at our Medicare lead programs, you're going to be paying per Medicare lead anywhere between $16 and $20 a lead. We look for that $16 to $18 mark, actually. Turning 65 to be $18, 66 and older to be $16. Okay, so when you look at that, when you're turning 65 and you're paying $18 a lead, what can that $18 turn into that you're putting out? So, and what I mean by that is, you get in there and you write let's say for the sake of argument, we're going to talk about a Medicare supplement client, right? The average Medicare supplement commission on a year one is anywhere between, the average is $380 to $430. Okay, depends on the premium, depends where you're at in the country, depends on the percentages that the carriers have. Michigan is is a front loaded state, where like the state of Nebraska is a more balanced state, right? So it all depends on where you're at, but that's the typical commission. So out of $18, 380, 430, you're going to be in that range. On top of that, that's your opportunity to get in there with that Medicare supplement lead to take care of the Medicare supplement, and then say, you know what? I also am a life insurance agent. I also am an annuity advisor. I'm also a wealth management advisor. And then that's your door to talk to that client, because they're turning 65. They're retiring. They're going to need those services. Hopefully, that's your opportunity to get in there and talk with that client before they talk to anybody else. So when you look at it from that way, and I do have an example. Okay, we have an agent. She's already an annuity advisor. She's been doing that, but she is new to Medicare. Got her on board. She spent $18 for a lead. Okay. She did a lead mailer, got her leads back. Got her guaranteed results back, which then averaged out to the $18 a lead. With that, she wrote a Humana Medicare supplement, right? That Medicare supplement meeting turned into a $230,000 annuity. Now, if we're going to look at this from cents to dollars, if we're going to look at what we're putting out versus what we're getting back in, do the math on that on your typical annuity contract. That's a phenomenal cross-selling opportunity that that agent had right there. And she would not have got with that client if she wouldn't have gone the door with the Medicare. She wrote an easy Humana Medicare supplement. The client was turning 65, retiring, so it was a guaranteed issue. The open enrollment, if you will, period. Checked a few marks. It took her 20 minutes to get through the application with this client to then expose a $230,000 annuity. So I would definitely tell you that's a huge opportunity. That's a huge scenario that we are seeing underneath our roof here at IAMS. We have a lot of agents that are succeeding with that. And that's one of the things I want to do with our agents here. That is one of the things I want to do with our agents is help you utilize these opportunities. A lot of FMOs, IMOs, like an IAMS, they offer one, maybe two different lead programs. I can tell you right now, we have three, and we are working on a fourth. We're doing some test trials with it right now to be a 1-1 lunch date, which will be, uh, without getting into grave detail, it will be Facebook-driven digital leads, which are turning out to be great. They are turning out to work out pretty well so far. So why bring your Medicare to IAMS? Because with IAMS, we're going to help you get in front of more clients. We're going to help you take advantage of as many clients as we possibly can. We're going to help you really pinpoint your marketing. Now, another thing is I've had a lot of agents ask me, and I want to make sure I clarify on this. We offer through IAMS, and actually let me flip over to the senior healthcare page real quick while we're doing this. Hopefully everybody can see that. If you cannot, um, please let me know. If you're struggling, please get in the chat box. Tell me if you can see the page or not. Okay. But here's our new senior healthcare page. Okay. You should see the picture of me, senior healthcare. It's underneath products, kind of explaining what we do on our team and what we're doing in the Medicare space. Okay. You'll see here we have the CSG quoting tool that we've gone over multiple times, and then you'll see Connect for Medicare. Both of these are quoting and enrollment tools that we offer you free of charge to work with IAMS. I've gone over this a lot, and if you need me to touch on any of that, please let me know. This is a good time for us to talk about it, okay? But we do offer these free of charge to you. And a lot of the agents that are using these, they go, okay, what's the difference between this and going direct to the carrier? What I could tell you is when you go to a carrier, you're only going to get those carriers' results. When you use CSG, you're going to see all the carriers on one page. What are we doing? We're trying to streamline your business. The whole goal to the Medicare side of the business, and what I'm trying to do here on the Medicare side, it's not like annuities where you have 1 to 2 carriers, right? It's not like life insurance where you have 1 to 2 carriers. Medicare, in my personal opinion, if you're a fully vested agent in the Medicare space, you have anywhere between 3 to 5 Medicare supplement carriers. And then really on the Medicare Advantage side, depending on how much of the Medicare Advantage business you're doing, you really need anywhere between 2 and 5, again, Medicare Advantage plans in your area within the hospital networks that you work. Why? Because if Mrs. Jones goes to Hospital A, and Hospital A may have United Healthcare, Humana, small network-based insurance, WellCare, SilverScript, they may have it all. That's what you need to be looking at. If you only have one carrier, well, what if the hospital, like what we run into, what if the hospital's not contracted with United Healthcare, but that's your only Medicare Advantage carrier? How are you going to take care of your client? Okay, Medicare Advantage gets more in the depths of that, and that's a lot of the coaching that I'm trying to help bring over here to the IAMS side is the Medicare Advantage agents, working with them more in depth like that. But the whole goal that I have is not only to provide you options, but to streamline your business as much as possible. Okay. I have a private question coming through. Okay. How about that? Apparently my poll that came across. Okay. So here's the screen. Okay. Well, I'll go back through it here one more time. So when you go to the IAMS website, IAMS.com, IAMSinc.com, you go underneath products, senior healthcare. If you've come to this website before, you're going to notice that it's changed up. If you haven't, it is changed. Okay, I have some questions coming through. Oh, that's because they did a poll. I apologize. Okay. Contract Medicare carriers. Okay, we got pretty good results there. Um, so anyway, the senior healthcare page, senior health products. This is what the IAMS' objective is to do. This is me. Here's my senior. I am the senior health sales director here. This will show you kind of what my background is and what I'm doing. Okay. Uh, you can subscribe to our emails today. A lot of agents, I suggest you do that. We are going to get market, changes, whatever may be happening on the Medicare side, but life annuities, everything like that. Here is a good picture snapshot of the carriers we're on board with. Now, I have probably added 3 to 4 more carriers on this site. I actually am looking here, and there's a carrier I need to get added on here, which is Lumico. We do have Lumico. So I would say add one more. This is a snapshot of all the carriers we do represent. We are adding to that. Now, I did just have an agent down in Texas. He stated to me, we have a lot of the competitive carriers, but in his county we don't have Baylor, Scott, and White. Here's one flaw I can tell you we are gonna have, okay? And as you'll find out, I'm very transparent, very honest with our agents. It would be very difficult. The Baylor, Scott, and Whites out there, the Priority Healths in Michigan, the Clover over New Jersey, we would have way too many. As you as an agent have to get contracted and you have to be AHIP certified, everything of that nature in order to write the business. So with Medicare, just like you as an agent, you have to be AHIP certified. You have to do your product certifications, everything like that, in order to write the business. It's the same with us. So it'd be very difficult for us, and we do need to find a solution to have every single Medicare Advantage carrier out there, right? We have to, it just would be a tremendous amount of work. So I will tell you, when it comes to your carriers like Clover, when it comes to your carriers like Baylor, Scott, and White, uh, Florida Blue, Blue Cross Blue Shield is kind of a difficult carrier as well for a broker side to get contracted with. We do have to find a solution, but we are not going to have all those. Now, if you are an agent of ours and you're writing business and you are active, and that's how we kind of have to gauge our time management, if you will. And I don't mean this in a greedy way by any means, but if you're an agent and you call me and say, Alex, look, I know you don't have Clover. I really want to work through you. I need Clover though. I need you guys to get Clover. I'm going to put about 100 Medicare Advantage apps on the books this year alone. We will definitely take a look at it. But just to say maybe 1 or 2 apps, I would tell you I just don't think we're going to be the best solution with you when it comes to those carriers. And again, the more we grow, the more we are going to be able to take advantage of those opportunities and add them. Just right now, I can only work with what I have. Okay, so I have gotten that question a lot. I know that's not the best answer, but that is where we are at. Um, Real quick, I know we need to run another poll. This time I'm gonna wait to move on until the poll is done. And again, feel free today. I appreciate we do have a pretty large attendance of people that are on. I do appreciate everybody taking the time. I know this week is a short week with the holiday. Also, it's coming down to for the Medicare Advantage agents, which I do see quite a few of you on here, and I appreciate you coming on board. December 7th is coming with the quickness. So I do appreciate everybody coming on board and speaking with us today. And again, make sure you use the questions box to ask any questions or want me to go over anything in particular. About another 28 seconds here. Okay, I am going to close the poll. I will not be able to see those results until the end. I do apologize. So once we're done with the webinar here, I can get on there and look at the poll. Now, can everybody see the screen? Are we good to go? Can everybody see I believe the poll should be down now. Can everybody see my screen I'm trying to share here? So could just give me a quick response. Okay, thank you very much, David. Okay, so moving on. So I know a lot of the agents, and I have seen some people ask me this privately here, to go over our lead programs that we're offering. Let me go over this. So with our incentives, okay, we have the CSG tool. We have the Connector tool. We do offer those to you free of charge. I would honestly tell you that as a bundled together, those are it depends on the state you're in. That's a $2,800 to $2,200 value a year. We are giving it to you free of charge to work your contracts here through IAMS. We will look for the competitive carriers. You know, we are going to want to have a couple. We completely understand at the beginning here, this needs to be a relationship, not a marriage right away. I understand completely that there are other outfits that you're working with, especially some of you, if you did answer that you already have Medicare contracts, you're not going to be able to you're not going to move every single one of your contracts before actually, you want to dabble your toe into the water, and I get that completely. So with that being said, we offer you the CSG and Connector tool to work with us. I would say we need anywhere between 3 to 5 carriers in order for you to qualify to earn those, and we can work through that if we need to. We do have special circumstances. I have an agent right now. She wants to move more of her products to us, but right now she's locked in until the first of the year, but she would like to take advantage of our tools. Obviously, we gave her an exception on that. We're going to work with her for the first of the year and focus on that afterwards. So we do have special circumstances. We're not completely black and white. There is some gray area that we're willing to walk in. So not only do we have the CSG tool, the Connector tool, but we do have the 3 lead programs right now. And I'll go from what I would consider lowest to biggest, right, for opportunity. We offer you as a company at the lowest, I would tell you, but this is a very fruitful opportunity, and I'll tell you why. We do offer you data. And what I mean by that, they are just raw data leads through the state. They are just these aren't responses. These aren't qualified. This is just a simple, yes, they're in Medicare. Yes, they're in these income ranges according to the state. And yes, they live in X areas. Okay, that's all it's going to tell you. It's going to spit back a list to you with phone number, email, address, so you can do marketing. Now, a lot of agents would say, why would I want a non-qualified lead? Well, this is exactly how you can take care of this opportunity. One, we do have agents that are starting to sell over the phone. Anybody that sells over the phone knows that is definitely a quantity game. You have to put out the numbers to start bringing them back in, right? Why do phone sales? Because phone sales help you, let's say for the sake of Nebraska, if you're a Nebraska-based agent, it helps you cross-sell in other states, get your footprint in other states. Another thing I could tell you about the leads is it allows you to do your own marketing. Now, a lot of our agents utilize this, okay? And I'm going to kind of go in a roundabout way to explain to you a solid scenario some of our agents do. Underneath our roof, a lot of you have heard about our creative team, okay? Our creative team, Sean, Jacob, they're in there. We do have a new one that has just started, Riley. She's in the department as well. What they will do is they will build you pieces. And what I mean by that, mailbox fillers. If you want to put together a website, if you want to put together email blasts, things like that, our creative team will do that for you at a certain cost. And I would tell you, if you look at our cost versus the commercial costs, we're gonna beat 9 out of 10 players out there. The reason why is we have specifically chose to not make a profit on the creative team due to the fact that in the long run, we're going to work with you and we're going to make it up in the business that we produce with you, right? So a lot of times what we have is we have an agent that calls in. I'll give you actually a prime example. And we had an agent that had our creative team build a postcard. It was a laminated postcard, had a message on there, hey, we missed you, or hey, you should have seen something like this, or don't forget to give us a call. All right. He had 3 different messages that he put on there, big nice postcard. It was had his face on there, his company logo, what he's about, and what he did is he used those data leads that we gave him as his data to mail those out. Now he was responsible for his own postage, but we gave him the data to use at a free cost to mail out to all of his clients, and he's getting a tremendous response. Why? Because his postcard looks different than the rest of the postcards every other agent is getting. Lead companies, for the most part, their lead card looks very similar. I don't know how many of you bought leads, but their lead cards look very, very similar. His stands out from the bunch. That's the way he does his turning 65. And then what he does is use that same data about a week and a half after he's mailed it out to then call on those and have his office call on those and say, hey, you should have seen something like this. Did you get it? Yes, I did. Well, let me explain to you more in depth of who we are outside of what that postcard showed you. Or, did you receive this? No, I didn't. Well, this is what the postcard should have told you. This is what it was about, right? But they know they mailed to a client turning 65. So that's an opportunity right there, like I said, to use when it comes to data lists. We can go on and on and on for examples. I'm not going to do that to you. Another lead generation tool that we have is our 1,000-piece lead mailer. Okay. Those are, I believe the cost, again, depends on where you live and depends on the demographics you're looking for. Are in between $450, $500, mails out 1,000 pieces. There is no guaranteed on response, but I will tell you right now, the national average on that lead system is 2 to 3%. So out of 1,000, you're getting 20 to 30 clients. Again, let me explain to you why I like that lead system. We not only mail it out for you, the company will mail it out for you. They will also give you a spreadsheet of all the data, all the 1,000 clients that lead mailer went to. You can take out the ones that maybe did respond and call on the rest, or use our creative team again to redrip market back on those same clients that did not respond. Hey, you should have seen something like this. Sorry we missed you. Some message like that to get your company, your logo, your agency in front of these clients for them to reach out to you. That is a tremendous tool to use. I would tell you that 1,000-piece lead mailer generation is probably nationally the more popular one that a lot of IMOs, FMOs like mine offer. $450, $500 again for 20 to 30 clients. That's a very solid ratio. Again, there is no guaranteed on that response, but it gives you a lot of data. That's at least 1,000 names of data you can utilize through your agency to take advantage of. Now, the third lead program that we offer, and I would tell you this one is my favorite, is ours that has a safety net of guaranteed responses. What it is you have to buy a minimum of 20, okay? And a lot of you have already heard me talk about this, but we do have some new people on here. But the minimum is 20. You have to buy a minimum of 20, $18 a piece for turning 65, $16 a piece for 66 and older, okay? You are guaranteed those 20 responses back before they charge you, okay? Now, if they don't get the 20 responses, you don't have to pay for them. If you don't get the 20 responses, you can make the decision whether or not you want to continue moving forward with that or not, or if you want them to maybe try a different area, try a different zip code. I had an agent the other day. She put out a lead mailer. She only got 5 back on that. And the company, rather than bill her, said, hey, is there some other areas you'd like to test out? She gave them 3 more zip codes, and then they actually pulled 32 leads in total back for her. She paid for them. Do the math. Great opportunity for her to take advantage of, because these are qualified leads, people actually responding back. That is probably my more favorite one, and the reason why you're going to be spending anywhere between $340, $360 for your 20, somewhere in that range. So it is a little bit cheaper than the 1,000-piece lead mailer. And also, it does have a safety net with a guarantee of leads before you have to commit to anything. The fourth lead program that we are working on, it's in the test trials right now, is a Facebook-driven lead program. They are digital leads. They are ad campaigns through Facebook. I call them Facebook, but there's probably, I would say 75% of it's Facebook driven. The rest of it's kind of a mixture of about 3 to 4 other digital type programs to gain the audience's attention, if you will. That is not live yet. We are in the test trial phase. We're running that with 3 individuals right now, and it is actually pulling some pretty solid numbers. I do look forward to work with all of you after the first of the year to kind of explain more in depth of how that tool operates. I'm going to wait here, see if we have any questions on those lead programs. Okay, a private question I had, please go over the creative team again. So the creative team, what it is it is our marketing department. It's our graphic design department. We have made the decision as IAMS to, and it's really, really working out very, very well, to not only you see the pieces that we put out, right? Our email blasts, our mail marketing, our booklet, our brochure booklet that we send out every quarter. You see our website. We have decided to allow those same services at a cost, which is a very low cost. And again, I can go over. I do have a creative sheet. It's their pricing sheet. I can share that with everybody if you'd like. Please just respond in the questions box if you'd like that sheet. But what they will do, especially for someone that's starting to build an agency, it's a tremendous tool. They'll build you a website for a certain cost and then maintain it at a very low fee monthly for you. They will build you marketing pieces. They will build you mailbox fillers. They will give you, there's a lot of different things. If you want, stress balls, pens, things like that, they will build those logos for you. They will do a logo for you. If you're a new agency, I just had an individual come on board. He's really well versed in the annuities and Medicare side. He is having tremendous success, has his own ways of getting in front of those clients. What is he doing? He's starting to build an agency. He's going to mirror his success through other downlines and train them. First thing he wanted to do was build a business name, logo, website. We did all that here through him with IAMS. On our life and annuity side, we do have for every $100,000 in premium you submit, you're an X amount of marketing dollars. Those marketing dollars can offset your expenses with the creative team. Definitely make sure you follow up with me on that if you have any questions. Our creative team is a tremendous resource for a lot of our agents. We do have website examples, so you can take a look at some of the work they have done over the years for these agents, and that website is 100% yours. It is not ours. So a lot of times agents ask, what if in the event that we part ways, whatever it may be, that website's yours. Obviously, we will no longer maintain it for the fee that you get it for working through us, but that website is yours to take with you. So definitely use our creative team. Again, those data leads, tremendous pairing right there of what they can do to help you be more efficient when it comes to your marketing dollars you're looking to spend. Okay, one question I did just get here, and I know I get this one a lot. So the CSG actuarial tool and connector tool that we offer you to compare and enroll your clients, no, that does not come at a cost to you. That your commissions are not affected. I know that's been asked a couple times. What do you take out of my commissions in order for that to be paid for? Nothing. We have struck a deal to where we do pay for those services for you, but there is no cost to you to have that other than contracting with us. I know a lot of agents, for some reason, they believe or have heard, whatever it may be, that we take some of your commissions or you have to take a lower level, something like that. That is not the case. Those are to you. Actually, all of our incentives are to you free of charge, just contracting with us. That's the only cost. Yes, we do. So I just got a question on here. The lead program, can you take advantage of all of them? Yes, you can. We do. We have a lot of agents. That's exactly what they do. We have agencies, they come together, and they kind of, I would say it's the law of large numbers. And what they do, they use everything from the free data that we give them to using the 1,000-piece lead mailer. And they not only take the responses from that to try to generate sales, but also use the data of who didn't respond to also use as their own material, their own data resource to reach out to clients. And then, yeah, the $340 to $360 for 20 leads, yeah, that's to you free of charge. What I would tell you is if you are in the process of wanting to build an agency yourself, you can take everything that I offer and use that as your own recruiting hook to your agents. I would actually promote that you do that. Um, if you want to bring on 2 to 5 agents on, beneath you in 2020, use my leads, use the CSG connector tool, use our creative team, things like that as your own hooks to recruit your agents, and use our creative team to help build recruiting pieces for you. Please explain levels on team building. Downline examples from building a team. Okay, so David, let's take this for an example. You're at a certain contract level. Let me start off by saying you will always have the level here underneath our roof, the same level that the carrier would give you. We never hinder that. You'll actually notice underneath our roof, you are contracted direct with the carrier. Your commissions, when you get your commission statements, they are directly from the carriers. You're not paid out of our office. Okay. Now, our incentives, our marketing dollars, things like that, those are out of our office. But your actual day to day business, client business, that is between you and the carrier. Your book of business does remain your own. So when you are building a downline, a lot of times what agents need, what do you need as an agency owner? You need spread, right? That's the whole reason why you're building the agency, is to not only for your own business, but then to get other agents, you mirror your success to those agents and then earn a cut from everything that they do. We will give you the exact same level that the carrier does. So David, for example, if you come here and say, Alex, uh, I'm going to recruit 2 to 5 agents. This is my game plan. This is how I plan on getting it done. I would also like to talk to you about it verbally and kind of give you an idea of where I think the carriers will work with you, where some of our incentives will help you. But I will always ask for a full business plan in an email, because what I will do is I'll take that email to our carrier reps and say, hey, this is what David's looking to get done. Here's his year 1 goal. And then this is where he's looking to be after 5 years. What can we help him to get that done? They'll talk to us about commission levels. They'll talk about their own incentives, maybe things that they're willing to do for you. On the Medicare Advantage side, marketing dollars are a big thing, where these carriers will give you marketing dollars. They will give you a certain amount of marketing dollars to allocate to your agency, things like that. So I will tell you, we have quite a few agents taking advantage of that. They're letting us work with them. My team and this company will work with your downlines. You go out there and you get the downlines. You got to talk about your personal agreements that you're going to have with those individuals on why to bring them underneath your downline. But when it comes to our incentives, their day-to-day business, new business, use our new business team, use our contracting team, use the sales teams, all of that to help you run your agency on a day-to-day basis. We have no problems doing that. You'll get the same service as an individual with your agency. So I had a private question come through. Yeah, if you want to. So if you have a website and you want our creative team to take it over, I'll get with Jacob. Jacob is the main one here underneath this roof that runs with the websites. But yeah, you can definitely build a careers page if you want to on your website. We will always give you feedback, but ultimately what you want to do with your website, we'll work with you. Oh, hey, no problem, Cynthia. Yep. No, this webinar today is a little bit loose leaf. It's a little, I don't want to say unorganized, but really what today was to get on there. We've had a focus on all the other webinars. Today's main focus was just to go over exactly what we talk about, what we do, how we help underneath this roof. And I do have one more poll that I'm going to put out there, and we will talk here in just a couple minutes. Give it about 20 more seconds for the poll. Okay. Yes, I do. I had a private question come through. Yes, I am. Today, I'm assuming, because some people, they listen to me as they drive. Today, there's nothing really specifically on the screen you need to look at other than going through the website, which I can do with anybody privately again as well. If we need to take some things off air to be more, focus to your needs and what you need from being an agent, agency, whatever it may be, we most certainly can. Today was just really to do an overall overlook of who IAMS is and what we offer. I just had a private question come through. So, what do I feel is our most lucrative opportunity underneath IAMS that separates us from other FMOs? What I would definitely tell you is I come from the broker world. I've been doing this for quite some time. This is my second broker I've worked with, and what I can tell you is I've seen what a lot of other brokers do, how they operate. I've had feedback on both positive, negative about all different sorts of brokers with other agents. One thing I will definitely tell you that IAMS does is it is our customer service. I will tell you our agent support has been the biggest hook, if you will, for these agents and agencies to want to work with us. I think we offer a 3-ring guarantee on the phone. That alone, I think, is what really differentiates us. I can't tell you how many agents I hear they're working with other FMOs, IMOs, and they're leaving voicemails and don't hear from them from day in and day out. Here underneath our roof, that phone does not ring more than 3 times before somebody picks it up. And I would tell you that is definitely something our agent support and agent attention even is definitely something that sets us apart. Another thing I will tell you is our creative team. I cannot tell you how much that shocks me. A lot of agencies have a lot of FMOs, IMOs have lead programs. They offer the same kind of tools that we're offering. I don't know of really any that offer the creative team like ours does. The today, what I went over with you, what that creative team will do is really a general overview, but again, they're not really black and white. If there's something from a creative marketing, graphic design, whatever it may be standpoint that you need, they will take that and work with you, and they'll work accordingly to what your need is. Seminars, we do a lot. They help with a lot of seminar materials. Again, website design, mailbox fillers. I mean, really, their ideas are you bring it, they'll do it. I really have not heard a whole lot of no come from them on things that they'll do. Next question I had was contracting. So yes, Cynthia, we will look at contracting. Medicare supplements can be sold all year round. There's not really a blackout period for those. Medicare Advantage, there is a blackout period. So with us only having really a month left in the year, majority of these carriers on Medicare Advantage go on blackout periods, 1st of September. There's so even if we did try to move your contract in today, they're going to give you a no until 1/1. So really today, anybody that's wanting to move contracts over to us, move business over to us on the Medicare side, this is not life and annuities, okay? On the Medicare side, I would tell you, let's aim for a 1/1 start date. Let's be realistic. We can put together, we could talk beforehand on game planning, business plan, if you will, on what you need from me, what in return we would need from you, things like that in order to make this work. But really, I mean, yeah, we'll work with anybody and everybody. We're not an agency based FMO. We work with independents to agencies. It doesn't matter. But I would tell you contracting right now on Medicare Advantage is going to be a little difficult. So we'll just look for a 1/1 start date. Plus, there's only 12 days really left in the season as it is. So by the time we'd even get you contracting, you'd do your AHIP and product certifications, you'd have not really any time at all to get out there and get done what you need to get done. Yes. So Riley just asked. Yes, we Medicare supplements can be sold all year round. So January 1 to December 31st, Medicare supplements can be sold. There's guaranteed issue periods. That's actually more of a rare one, believe it or not. A lot of people confuse open enrollment with guaranteed issue. Open enrollment is new to 65, rolling off their group coverage, the new plan, new to Part B. Those are open enrollment. Other than that, your clients and you can flip in and out of Medicare supplements all year round as long as you can pass underwriting after that. Now, we don't want you going and for 3 months having 3 months having United Healthcare, 3 months having Humana, 3 months having Cigna. No, that would be a huge mess. But a lot of times when someone gets a plan at 65, I would say the average change on a Medicare supplements between like 67, 68. The reason why they're still relatively healthy, but they have just taken the natural, hopefully smaller increases in their rates that they can sit down with you and say, hey, at the time I was paying $90, now I'm paying $110. Is there anything I can get to get back down to that 90 range? Go through some underwriting, pass them, move on. Medicare, yes. So Medicare Advantage, new to 65, new turning 65 or new to Part B, then get their Part C. Um, and then after that, you don't have to wait till AEP to write your initial client. You can write them again at retirement, new to Part B. From then, no, it's not open year unless a network drops a certain carrier, uh, the carrier pulls out of the state, whatever it may be. Those do open special enrollment periods for your clients to move Medicare Advantage plans. Other than that, they do have to wait for what we're in right now, which is the annual enrollment period to flip in and out. So what you're talking about is after the first of the year. What that is after the first of the year, if say your client gets on a United Healthcare plan today, an agent sells them a United Healthcare plan today, and then after the first of the year comes and they realize maybe that's not the best plan for them, or their provider doesn't accept United Healthcare, or uh, there's just something that's more competitive, they can use that time to get out of that and go back to their original plan of whatever they might have been on. Yep. So Medicare again, yeah, that's exactly what my team, myself, my team, everybody underneath this roof will help you with is your agent support. And it is things like that, yeah, going through all the different enrollment periods and all the different guaranteed issues. So, um, yeah, absolutely. Yep. So we are more than welcome to talk to the carriers for you. There are some things that carriers will come back and say, they won't be able to talk to me on that. They might be able to give me information to give you. You may have to call in. A lot of times, if that's breaking into not necessarily, they'll give me client information, maybe talk to me about your application. But if things outside of, there are some rules that they just will not talk to us on. But for the most part, yeah. Actually, this last week I was talking with somebody, and they have two applications being held up at United Healthcare right now. Get that over to me. We'll get that divvied out for you. We'll get that figured out. We'll go to United Healthcare and say, hey, what's we always start with just the general phone numbers, if you will, the general 800 number call-in numbers. But if we're not getting very far, we do have our own carrier reps, things like that. No, unfortunately, you can't necessarily use our carrier reps because they're there to work with the broker side, right? Just to keep their day-to-day organized. But yeah, we will work with you. We'll try to find you as many answers as possible. We will try to basically. My job underneath this roof, our teams, our this whole company's job is to take as much back office administrative type. I don't want to call it stress or pressure, but work off of your shoulders as much as we can, so you can focus on your day-to-day business, which is working with your clients. So yeah, I mean, definitely utilize my office. I mean, that's what we're here for. That's what the entire office is here for. And that's not just the Medicare side, but that's life, annuities, everybody. Yep. So today, even even if you said no on the poll, we will be calling on the webinar attendees, see if there's anything else you may need. If there's not, if you think we're a fit, you want to talk after the first of the year, anything specific you want to go into, yeah, we will talk with you after the first of the year. We'll talk with you today. If we have to, we'll aim for the first of the year. I'm sorry. Just going to give it another minute or two here, see if we have any other questions that come through, and we'll go from there. Just had a private question come through. What is our release policy? So IAMS is a release-friendly company. Okay, and what I mean by that is if you call into me, I'll talk on behalf of me to life and annuity. The life and annuity side, they're release friendly as well, but I'm not going to talk to them about what their requirements are. I have my requirements on the Medicare side. If for some reason uh, there's a debt to us, we don't release. Other than that, we don't handicap or hold agents hostage. If I understand there's a reason why there's hundreds of different FMOs and uplines and agencies out there. They all offer something, and it may be beneficial for those agents, something that they offer that we don't. Obviously, we're going to do what we can to keep your business. We're going to try to keep your business as much as possible. But at the end of the day, if it's a better fit for you to leave and you got to take your business elsewhere, we're not going to hold you captive here. That's just not how we operate. Again, if there's debt that's owed for whatever the reason may be, chargebacks, things like that, no, I mean, obviously we're not going to part with you on debting ways, right? Other than that, I mean, there's very few reasons as to why we would not release. I really think that's probably it, to be honest with you, just off the top of my head right now. So, yeah, and also we're not a captive agency, so we are fully independent. So if today, if you're new here and I call you, and you maybe only want to bring 2 to 3 carriers with us, but you in total work with 8 to 10, that's fine. We'll build our relationship outside of there. We obviously want to try to bring as much business underneath our roof as possible. We are in the business too as well to make revenue and be successful and grow, but at the same time we understand we can't expect the agent just to fully jump ship with us all in one shot. So, yeah, we work with our agents in a lot of different ways. A lot of different ways. Yeah, if you go and look at IAMS's homepage, it'll say right there, spent on agent support, $72 million. And it'll tell you right there, we've been helping producers for 32 years. We have 60 plus carriers underneath this roof. I know I've definitely added to that bunch since we've come on board. Invested into agent training, $3 million. With us, I mean, those are real numbers. What that is that's everything from our annuity academy that many of you have probably seen web emails on, an email blast doing our annuity academy with our advisors. That's everything from that to offsetting these lead costs on some of the things that we're doing. The creative team that we're investing into that to keep our prices low, things like that. I mean, we definitely see the value of investing back into our agents and helping them be successful. Looks like the questions are starting to slow down here. Okay. Well, today went a little bit longer than I thought it would. I apologize, but it's a lot of detail. It's a lot of information um, on how to really take advantage of the business as a whole. The more in depth you get, the more success. The agents I honestly see you get more in depth with their business and their drip marketing and their constant just touching of the market, the more success we see. A lot of agents sometimes they just sit back and they work on a referral basis. That's fine. Not all agents have that privilege. Some agents are just starting out. So yeah, I mean, we really help you try to do everything we can to get in front of the clients. So if you have any questions, need any help with something, call in. Our number is 800-255-5055. I'm going to put the PowerPoint up here real quick. You should see our number there off to the top right. Definitely call in, ask for me. We'll delegate as needed and go from there. But yeah, we are here to help you as much as we possibly can. And with that, I'm going to sign off here. I'll show my screen here just for a little bit more if you need to write down that number. Again, call in here. I'm going to go back to my desk here. I got to catch up. I was out of town towards the end of last week. I'm catching up on that. I will follow up with everybody. And again, I really, really do appreciate everybody taking the time to be on here today.